America is getting older. In fact, more than 4 million people in the U.S. will celebrate their 65th birthday this year alone. Turning 65 is significant for many reasons, but perhaps most importantly, because it marks the beginning of a new healthcare journey with Medicare. Experts say planning before you are eligible can have a positive impact on your health for years to come. Here to explain and share the key steps for younger seniors to explore is Dr. Jennifer Taylor, Senior Medical Director at Humana. Thank you, Dr. Taylor, for joining us.
Thank you for having me.
What advice would you give people turning 65 this year to prepare for being eligible for Medicare?
Well, there's a few things. The first of which is to start your research now. It's important to understand all the different parts of Medicare so you can make a choice based on your own health needs. With Original Medicare, you get coverage for hospital stays and doctor's visits, but there's a deductible for each, and you're responsible for 20% of the cost. Whereas with Medicare Advantage, you get coverage for hospital stays, emergency visits, doctor's visits, and you may have coverage for prescription drugs as well. And there's a yearly cap on your out-of-pocket expenses.
Primary care plays a critical role in managing our health, but a significant number of Americans don't have a primary care doctor. So for seniors who do not have a primary care provider, what considerations would you recommend when making that choice?
Having a primary care doctor that knows you, knows your health history, and knows your individual risk factors can make a huge difference in your quality of life and longevity. Your insurance provider can connect you with doctors in your area that accept your plan. Here at Humana, we recommend for our Medicare Advantage members that they find a doctor that's involved with value-based care. Because with value-based arrangements, you have longer visits and more frequent visits with your doctor. And so you get to ask more questions. Your doctor has more time to get to know you better. Your doctor gets to know things about you socially and emotionally that might be impacting your health.
Well, what would you say are the most important things these younger seniors can do to stay healthy?
Well, once you've found your primary care doctor, it's important to schedule an annual wellness visit. This is where you'll sit down with your doctor, you'll go over all the preventative screenings that are available, and you'll select which ones are best for you based on your own risk factors. Screenings make a huge difference in terms of your long-term outcomes. And then it's important to understand all the different Medicare benefits. For example, Part B covers things you might not expect, like smoking cessation. And Medicare Advantage has a host of other benefits that you can explore.
Okay, one last thing before we go. How does loneliness and maybe social isolation really impact the health of seniors?
Social isolation impacts as many as 43% of seniors, and it puts them at increased risk of health challenges. Loneliness can cause mental health issues, and it can even cause increased risk of death from common health conditions like heart disease, stroke, and dementia. So at Humana, we try to look at the whole person, and we try to identify people who are at risk of loneliness and social isolation and get them plugged into community resources. And we try to make sure they're maximizing all the benefits that are available to them.
That sounds like a great plan. Dr. Taylor, where can our viewers go to learn more?
Humana.com for information about Humana's offerings, but Medicare.gov will allow you to compare Medicare, Medicare Advantage, star ratings, which give you information about the quality of plans. It's all there at Medicare.gov.
Great information. Thank you so much.
You're welcome. Thanks for having me.